To arrive at a diagnosis of an immune deficiency, it is very essential that medical practitioners out there, especially pediatricians and physicians, are aware about these diseases. Now, if you ask me when should a pediatrician think of an immune deficiency or when should a physician think of an immune deficiency, I'll give you simple clues. One is infections. Now, as pediatricians, children often come to them with recurrent infections, maybe repeated viral infections. And if children are doing well apart from viral infections, I would suggest you should not investigate. However, if children come to you with severe, persistent, unusual, recurrent infections, severe infections that need multiple hospitalizations, like severe pneumonia, chest infections, ear discharge, recurrent episodes of diarrhea, unusual skin infections, and if children are not growing well, what we call failure to thrive, that means they are not gaining height and weight as per their age, that is where pediatricians should start thinking of an immune deficiency. It is also essential to think of these group of diseases if children come to you with cancers along with infections, or if children develop autoimmune diseases at a very, very young age. Usually, autoimmune diseases in children start at a later age, but having autoimmunity before the age of 5 is very unusual, and that is another place where pediatricians must think of an immune deficiency. Now, these diseases are not restricted only to children. Even adults can suffer with an immune deficiency. The most common immune deficiency in the adult population is the common variable immune deficiency. And adult physicians who deal with these patients can suspect this disease when they see a patient coming to them back to back with chest infections. Often these patients would go to pulmonologists and they undergo bronchoscopies and several investigations without getting an appropriate diagnosis. If patients come with chronic diarrhea, loose motions that just don't stop, months together of diarrhea, weight loss, in such situations, the gastroenterologist may be dealing with these conditions. They must investigate. Sometimes these patients come with cytopenias. That means the blood counts are very, very low. The hemoglobin, the platelet count, the white cell counts are very low. The hematologist must be dealing with these conditions. Again, there is a need to suspect these diseases in this setting. As far as the parents or as far as the patients are concerned, I think for them it is very essential to make a note of all these symptoms, because when they go back to physicians or their pediatricians, they would be often prescribed antibiotics. But then if they can make a symptom diary, and when they report to their physicians, present the symptom diary and tell them that how they have been suffering again and again with repeated problems, it is then when the pediatrician will make a note of the symptomatology and start working you up for an immune deficiency. Because right now, I would say several cities, almost all the metropolitan cities will have investigations available for evaluation of these group of diseases. So the word frequent, if you go back and refer to the Jeffrey Model Foundation, what you say, JMF, warning signs of immune deficiency, they would state if there are 4 episodes of ear discharge in a patient within a year, or more than 2 episodes of pneumonia in a patient within a year, several episodes of diarrhea, or oral candidiasis beyond the age of 1. So these are few numbers that this foundation has laid down to bring about an awareness. But let me tell you, these numbers are very arbitrary. For a physician or a pediatrician who regularly deals with patients, he would know that this particular patient is coming too often than usual. So unusual here would mean unusual number, wherein the pneumonia is happening again and again. It could be unusual severity, a patient with an infection landing up in an ICU, or it could be an unusual pathogen. So when you have infection, we look for what microbe is causing the problem. There are some common microbes, there are unusual pathogens like fungus. So it may be the first episode of fungal pneumonia, but it will need investigation. So and another important aspect, very, very important aspect, is the family history here, because these are genetic diseases. So often we see that the first child was suffering with a disease. They could not arrive at a diagnosis. The child expired. He could not make it. And the second child is brought to us. And just because the family history was positive, we were right on the toes that we were like, we have to investigate. And that is where we got the diagnosis quite early. So a good family history does help in this situation.